Thank you very much, John, and the high table. First, I want to, I feel like it's really the Grammys indeed, like he had mentioned. So I want to start by thanking John and Huma, the organizers of IVHEM, and it's a real pleasure and honor to be here today. It's great to meet old friends and to make new friends, and that is what I've been doing this morning. And also, we're here at the time to celebrate IVHEM at 10. That's a real great honor. So my talk today is in terms of progress towards viral hepatitis elimination, and we're looking at the WHO perspective. And this is my outline in terms of progress, identifying inputs for action, measuring progress targets, defining a path to elimination, strengthening data for country impact, and looking forward to 2024. I have 10 minutes to give this presentation, so it's clear that I shall focus on some areas that I would like to highlight. So this is the WHO Global Progress Report, which we all know about. It was to measure the progress between the years 2016 and 2021, and first to say that it's been updated, and new data will be out at the end of this year or the very first month of the next year. Now, this report showed the progress made in 2020-21 and provided new data on the burden of 296 million hepatitis B, 58 million hep C. It showed the new infections, 1.5 million of both, the deaths caused by liver cancer and cirrhosis, 1.1 million, and there was a benchmark acknowledgement and progress, and that is in children under 5, where the global impact and the SDG target was reached at 2020. Of course it was reached, but with significant inequities, especially in the Africa region. And before I leave this chart, just to show that liver cancer and liver cirrhosis are important mortalities and morbidities, as shown in the last, the figure at the bottom of the page. And if we just spend a minute on the progress of the cascade, you would see that we had, at that time, I can hardly see the screen myself, but at that time, it was about 10% of hepatitis B had been diagnosed and 2% treated. That's a real far cry from the targets that had been set in 2015. And for hep C, a shade better, up to 22% or 23% had been diagnosed, and about 13%. Does that mean I'm short? Now I'm too tall. All right. Okay, so on the last chart, interestingly, you would see that it's the Eastern Mediterranean part that has the highest progress in that time period. And it's not surprising. It is not surprising that Egypt constituted the bulk of that progress, and is the first country to receive the WHO gold tier for hepatitis elimination. And it's really great to see Dr. Hassani, because the victory of Egypt is the victory of all of us. And it showed clearly that Egypt achieved such significant reductions within the space of a decade. So it didn't take 2 years, it took over a decade to make this progress. The pictures are nice. The president of Egypt receiving the certificate, and the picture on the right shows several WHO staff from headquarters, from the regions, all participating in the success of Egypt. So just to spend a few minutes on this particular slide, and it's an interesting slide. It talks about the result chain, and the impact we want to achieve is to end hepatitis by 2030. And there are inputs and there are outcomes. You would see the bar beside it in green and in red. That is my scorecard of what we have done so far. Now, the global public health goods have been in existence for several years and they keep being increased. The national plans and country policies are red. The services, the diversity of populations and settings and inequalities remain red. And the health systems and the communities are red. Now it depends on input, because the whole essence of the result chain is to identify the inputs that need to go into the outputs and the impact. And the inputs are shown there: the political awareness, the community, the funding, the infrastructure, the diagnostic products and commodities, and very importantly, partnerships. John mentioned partnerships, and really we're highlighting Global Fund, Gavi, because they're global, but there are so many other partners, small partners that are in hepatitis, and there's a lot more needed. And then research and innovation. The scorecard at the input level is all red, maybe with a few dots of yellow in some areas. And I'll quickly move through the guidelines and guidance being updated and the measuring progress and impact. Now, attaining absolute hepatitis impact is only one aspect of viral hepatitis elimination. I've seen researchers and I've seen countries thinking they have attained impact or attained elimination by attaining impact. But for elimination, impact and programs must be reached. Now, this is a slide we may have seen before, and just to note that measurement of absolute impact and program indicators and targets, they're feasible and acceptable, and this country pilot was done to evaluate the feasibility of measuring the proposed elimination framework. And the pilot countries are shown here. I will not go into the methodology because of time, but I'm going to quickly go. Now, some lessons were learned. If you look on the left panel, we're looking at HCV incidence targets. And below this, we're looking at mortality. What did we really learn? We found that absolute incidence is difficult to attain on a population level due to the large burden of HCV. It requires retesting, resources, and commitment. Mortality is difficult to measure, even in the UK that served as a benchmark for highly developed countries, simply because of the quality of the vital statistics. Now, death certificates and cancer registries fail to capture the hepatitis B or C as the underlying cause of death. So it's difficult to assess and achieve the mortality targets of the guidance. The statistical modeling is great, it will help, but really it cannot replace the country data. And the program data, as you would see, was the best part of the pilots, because in all countries there were programs. The countries were able to measure the programs, but needle syringe programming for PWIS remained challenging. Now, that has brought us to a concept called path to elimination for viral hepatitis elimination. There are several rationales for this. I show before us the WHO interventions, 7 main interventions, and look at the targets for 2025, 2030, difficult to reach. Because of the data we had, the pilots, and with a global consultation, we came to the conclusion that we needed a path to elimination for viral hepatitis elimination. The rationale is written in the side. The bronze levels are benchmarking the 2025 targets. And there is an expected stepwise increase in progression from bronze to silver to golds. And the path to elimination focuses on reaching targets without the need to demonstrate incidence and mortality. After all, think of HIV, we're at 95, 95, 95. They are achieving their targets, but they didn't measure incidence or mortality. So this is a path to elimination that countries can use to track progress. And the rationale, like I said, is here. We're talking about progressive realization. So how do we get to bronze and silver? How did Egypt do this? They would share this with us, I'm sure. What will it take? There's a whole list of very important things I've mentioned. The bottom line is all the inputs in the result chain must be met. The financing needs to be met, the political commitment, the treatment services, the prevention services, all of them. There's not one that will not need to be met. And I think that is very important, and we will hear more of these from the countries. Now, I do not want to undermine the importance of capacity building, training of non-specialist physicians, because we're looking at a public health approach and not a specialist care approach. The path to elimination is through also the gold championships, and Egypt has demonstrated clearly that mortality is important, and for the path to elimination, gold is important to set up long-term surveillance systems in the country through sentinel sites, and this is being done in several countries, again with Egypt leading the way. And the last mile to elimination, impact of mortality, incidents, programs, plus implementation considerations. Some additional lessons learned from Egypt. It's from national to global. The quality of your laboratory matters. The public sector handling of viral hepatitis matters. Your programs assessment, your data quality, who is being left behind, all of these matter, and it was a huge learning point from Egypt. And of course, we're talking about human rights, gender equality and equity, community engagement, leaving no one behind. So the hallmark, again, strengthening data to measure progress. I'm looking at my time. Currently, we're updating the existing guidance of WHO for data collection, analysis, and use. And just to give a sneak preview, it is updating the outlined indicators, and it's focusing on those that are relevant. And we have a stepwise recommendation on improving hepatitis surveillance. And of course, there's a defined minimum data set for person-centered monitoring, which was not there. And there are some new indicators that reflect the new guidance, that reflect the path to elimination, and the upcoming hepatitis B guidance that will expand access to care. All of this will come in the first part of next year. And looking forward, WHO is everywhere. We're in 6 WHO regions, world regions. We attend to 194 member states, and we support the countries through the headquarters, regional offices, and country offices. And in terms of what is coming next for us, it's on the slide there, the Hep B guidelines, which we'll hear more about. Strategic information, there's an upcoming access report and integration. Of course, testing strategy and country support. Without the countries, there's no elimination. Resource mobilization is key. So to take home message, 7 important points that summarizes all that I have said, and I leave this for you to read. And on that note, I'm going to say a huge thank you for the opportunity to be here. And World AIDS Day, it talks about let communities lead. We should think about that for hepatitis as well. Thank you very much.